Okay, so this webinar is about scheduling in our practice and what that looks like and what to schedule for and why. The purpose and intention of this is to gain clarity in a holistic practice when you schedule, why you schedule, what you schedule for, and what kinds of things that we can help you with at our practice. Before we get started, I'll go over a little bit about me. So I've been in natural health care for 19 years. I started off as a massage therapist back in 2001. I achieved my associates in psychology and was really fascinated with the mind and how the mind works. I continued on to get my bachelor's in natural healthcare sciences because I have a passion in laboratory diagnostics and biochemistry. I continued my understanding of various natural healthcare modalities or treatments that can be used, and I got a BS in alternative medicine. I got my first doctorate degree in natural medicine, and that was more a continuation of the alternative medicine degree, really went over a lot more in depth into naturopathy, naturopathic practice, etc. And then I got my second doctorate in naturopathy. Also have a master's in public health with an emphasis in complementary and alternative medicine. I'm certified in functional medicine. I'm certified in integrative medicine. And also I am trained and certified in neurolinguistics, the mind-body connection, as well as clinical hypnotherapy. So I look at the world from various different lenses. I'm going to look at you from the spiritual sense. I'm going to look at you from the mental sense, the emotional sense, the food sense, the behavior, the habit. I also look at ancestral patterns and help you to detect that, as well as many other environmental things. So when I'm working with a patient, I'm really looking at it from a whole health perspective. So there must be a paradigm shift in natural healthcare, or just in healthcare in general, not just natural healthcare. But I think a lot of people don't have a lot of experience in my type of practice. So they're coming from the allopathic world, and meaning like they're coming from traditional medical world, and then they have no basis for coming into my world other than the fact that they've been let down, or they're disappointed, or they're frustrated, or not getting the results that they need for whatever reason, or they just want a more holistic approach. And so they wind up in my office for all kinds of different reasons. A lot of times it's because they've been to every doctor underneath the sun and haven't gotten any relief, or they've been to the doctors and nobody's told them what's going on or validated their concerns, dismissed them from their offices, or just didn't have the knowledge that the person was looking for. I've seen over the last 10 years especially, there has been this great paradigm shift in terms of people seeking natural health care. We're kind of coming full circle. People seeking natural health care alternatives. I don't typically use that word alternatives, but because we look at it as a complement. We are trained to build the health of the body. Our job as naturopaths are to stabilize the health of the body and really get the engine running. Whereas an allopathic doctor is going to be more reactive. They're just like the firefighters. They're going to constantly be putting the fires out. And so when a person first comes into my practice, a lot of it is behavioral modification and getting them out of reactive care. Because what happens is they come into the practice and they have all these symptoms. They've waited a long time. The body has gotten to a point of degradation that they're really suffering. And so they come into the practice with a paradigm of fix it, fix me, do it now, right? And so there's like this symptom, give me something to fix it. This symptom, give me something to fix it. And early on in my practice, I relished in that because it was fun, oh, great. And as I've gotten older in practice and I've just treated a lot longer, I recognize the need for a relaxed, process-oriented approach, because my role is not just to give you a Band-Aid. I don't just want to give you a pill or give you something to fix it in the interim. I really want to show you how your body actually works, and then how you can heal and become more empowered. And so that's going to take a little bit of time, rather than me continuing on with these fight or flight responses. The fight or flight is very reactive. It's very fear-based. It's, oh my gosh, I have a symptom. Reach out to Dr. Steele, fix it, fix it, fix it. And I'll do that a few times. And then I go, wait a second, like, we need to take a step back. Even though you may be suffering, there's a reason why you've gotten to this point. And if we don't slow down and really think through all of the different nuances, it's going to create a challenge. So I just want to bring light onto that, so that you understand coming into a holistic practice is a totally different paradigm than what you may be accustomed to. You may be accustomed to more of that reactive care, where, you don't come in unless you have a problem. This is a very different experience, and we'll kind of delve deeper as we move through. So as I was talking, why you schedule. So it's not reactive. It's not symptom based. That's more of emergency room or urgent care. It's, I have a symptom, then I need help with, right? In holistic care and naturopathy, we treat the causes. So there's a lot of subtleties to the body. Like, you don't just wake up and have a disease. I know we're conditioned and programmed to believe that that is true, but I just want to inform everyone that that's not. The body, biochemically speaking, it's systematic breakdowns of health. So nutrition starts to degrade, whether it's what the person's eating or their lifestyle habits, but also how they're digesting and assimilating it. So you're putting raw crude oil into your gas tank over and over and over again, and then toxicity is building up because it's unfiltered. And so you've got decreased nutrition, increased toxicity, and that really brings the body out of balance. And so when we're in holistic care, we really have to take our time, because literally anything can be anything. There's not a quick fix solution. And the more relaxed and the more rest and digest we are, rather than the fight or flight reactive care, the more that those things can come to us naturally. I recall many cases I've had where, we'll be treating for a period of time, and then all of a sudden, just, a clue pops into their head that is really important. Oh yeah, I had mono as a kid. Oh yeah, I've been on this medication forever. Could this be, an issue? Or oh yeah, I had this reaction. Or, oh, my dad worked in, a coal factory or something. There's a lot of different clues that at the time you don't think really matter or is connected. But then as we kind of piece together what is broken down your health over time, all those clues really matter. So I just want to reemphasize that we can't solve 20, 30, 40 plus years worth of issues, imbalances in an appointment, in one 30-minute session. It's just not realistic. My job, people come into my office and they dump their lives on my desk, and my job is to organize it and prioritize it in order of priority, meaning that, I've got to follow there's a certain order to which the body heals itself biochemically, and I'm working alongside those biochemical chains. So it's not like I'm just making all this stuff up. There's deep science that's involved in my practice, and it's not always conducive to explain all of it, and I do my best to explain it. However, sometimes, trying to synthesize lots of data in a short period of time can be difficult. But I do ask you, in that being proactive, be patient with yourself. Sometimes, I go over these blood work reviews with people, and it's like a total foreign language. They've never heard of half of this stuff. They're typically going off of what they've heard from here and there and everywhere. So a lot of it's relearning and re-educating yourself, and really freeing yourself from a lot of the just cultural brainwashing, if I can use that, in terms of, the agriculture has taught us, or, what, pharma has taught us, or just allopathy in general, or all of those things. And not to say that everything is wrong, because that's not the point. I'm very integrative in my approach. It's just that we want to make sure that we're working bio-individual. We're working on you, not you and 100 other people. But that's why I run biochemistry on every single person, because I want to understand how your body is functioning. So a lot of what I do is I'm a medical detective. I find the clues for care. So that's why it takes so much time, because it's like I get a clue here and I get a clue there and I get a clue here and I get a clue there. There was a show for many, many years, House, and he was very eccentric. He was a doctor, whatever, but he's very brilliant in the fact that he was always checking clues. So I'm very similar to House. Naturally, I don't have a drug problem and all that other craziness that he had in the show, but the essence of the show was very similar to what we do, or what I do rather, because there's all different types of naturopaths. I'm because of the functional medicine component, and because the integrative medicine component, and because of all of those subspecialty trainings that I have, it's really given me a very broad view of really who a human being is. And because of that, I can piece stuff together and figure out this clue and that clue, and eventually those recognitions, if you will, they create a snowball effect. And then eventually it's like I look up and, oh wow, I've figured out a lot of the nuances to the case. So it's very much peeling back an onion. So we start off at the at the outer layer, and then there's another layer and another layer and another layer, and it just keeps getting deeper and deeper and deeper until we get to the core, some of the root causes of why a person's unwell. So I know this is a lot, but I want to really touch on who actually schedules with me. So there's a lot of people that schedule with me. There's those that are preventative, meaning they don't have any symptoms, they don't have a diagnosis, they don't have a disease. But then there's also people that have chronic disease. They have gone through the gauntlet, they've been diagnosed with several different things, and maybe they're on a lot of medications, and that's why they're coming to me, because they want to minimize that. I also work with children as well as families. So I am a family doc. I love working with families and family dynamics. That's a part of the environmental training that I have, not just in toxicity, but also in home environment, and making sure that, parent-child can communicate with each other, making sure that husband-wife can communicate with each other, or husband, wife, whatever works, so making sure that there's dynamics that are involved in there, and that we're getting good communication just throughout, and everybody feels heard and understood and empowered. I also do perinatal, which is getting a person prepared to get pregnant nutritionally. And then prenatal, meaning maintaining their nutrients. You should never have food cravings if your nutrients are optimally optimized. If you have cravings and things like that, or you're really sick, sadly, more and more women are having complications with their pregnancy because of all the toxicities in our environment. They also haven't tested pharmaceutical drugs on women long term. I was just like blown away. I found in my master's degree that women weren't included in studies until the late 90s, early 2000s, and I was just astonished. And so we don't have those long-term studies. So now we're seeing a lot more complications with pregnancies, not just necessarily older women, but like young, 25, 30, you should look, a guy should look at her and she should get pregnant kind of thing. But she's having difficulty. And then, postnatal, so recovering, breastfeeding, making sure baby gets enough nutrition, that sort of thing. I deal with a lot of hormonal imbalances, thyroid conditions, adrenal conditions, menopause, perimenopause, all of those types of hormonal imbalances, mood swings, any kind of dysmenorrhea, which is any kind of imbalance with the cycle. neurological. So I deal with a fair amount of psychosis, schizophrenia, manic depressive, ADD, ADHD, those kinds of cases. Typically, by the time an Alzheimer's or Parkinson's case comes to me, they are on heavy drugs, and it's almost, so in some instances, it's they're just unwilling to make the shifts that are required. So the sooner that I see a case that extreme, the better, because I do a lot with the genetic and methyl genetic aspect of it, and just trying to preserve function as long as we can, because there's not a whole lot of that can be done, at least in the allopathic world, other than pharmacy. Digestive, so any kind of colitis, Crohn's disease, diverticulitis, IBS, IBD, any of the gassing, bloating, constipation, those kinds of things, upper GI issues. Nutrition, so just teaching people how to eat, what to eat, tracking their food, balancing their food, understanding their habits and behaviors around food. And then that goes into lifestyle changes. So, taking a person that eats fast food 7 days a week and they're going all over the place and they have no balance at all, I do really well with lifestyle changes. And then that going into that metabolic syndrome, so obesity, hypertension, diabetes, cancer, any kind of autoimmune immune style conditions. I've worked a lot with, so all types of cancer, breast cancer, bladder cancer, colon cancer, prostate cancer, with metastasis, without metastasis, with chemo on board, without chemo on board, with radiation. I work with some great oncologists. So that's really where the integrative healthcare comes in. And then high toxic loads, chemical sensitivities, autism, ADHD, anything in that space, definitely. So this is not an exhaustive list of the people that I have treated with or I treat currently with. This just kind of gives you a nice big broad spectrum in terms of what kind of patients that I see as a holistic doctor. I really, and that's why I like to be a generalist. That's why I'm in holistic family practice, because I love the family dynamic, love working with families and getting families organized, but also too, just helping to cast a wide net. I don't like to get bored or pigeonholed in one thing. I like to really kind of pick apart things and figure things out and that kind of thing. So this just gives you a brief summary of who I treat. Scheduling basics. So we're on Wellness Living. We use their app. You can schedule through our website. You can call our office. There's our office number, 685-4325-757 is the area code. I do appointments in person. We schedule in person, and then you can text our office. You can text that telephone number, and then also emailing the front desk. So this is how you can schedule your appointments. Scheduling is a little bit different in holistic practice than it is more in allopathic. And I think that's one of those paradigm shifts and distinctions to understand. So appointments are designed to build on top of each other, meaning that when a person comes in and they throw their life on my desk and I have to organize it in priority, I'm going to give you, a little bit to work on in this appointment, a little bit in another appointment, and each appointment is going to build on top of each other. As you become more proficient and you understand, health is going to build over time deliberately, right? So health is built consistently, deliberately over a long period of time. And so that's how we break it up if a person's in long-term care with me. It's definitely more of a preventative style practice than a reactionary. Not that I can't handle reaction cases, but I really, emergency medicine and emergency, all that, I leave that stuff to the allopaths. And also, when you're in a highly reactive state, when you're like trying to stabilize a person, like allopathy, just so you know, it in Latin, it means heroic measure. So it's really good for, you break a bone, you have a heart attack, we have to get you stabilized like quick, right? So trying to take that same approach into what I do is really hard, because when you're trying to solve complex cases, right, reactionary medicine doesn't work. Like it doesn't, you can't just go like, oh, okay, like it just doesn't work. Like you can't think clearly. The clues aren't going to come to you. You're going to get really stuck, and it just doesn't really work. So we want to shift from that paradigm of reaction to more. So it's like from medicine to healthcare. Like what I do is healthcare, right? And so in healthcare, we want to prevent things from happening, rather than in medicine, they want to treat it after it's become a problem. We want to catch it before it becomes a problem, and we want to stabilize the body sooner rather than later. So it progresses, and we're building health. I do just structurally, I have a 24-hour cancellation policy. That's because I prep for your cases ahead of time and make sure that I have everything that I need for them. And I typically do 30-minute appointments. So, I'm very fluid. Like I like to give the person that I'm in front of the time that they need. That doesn't always mean that I'm exacting on time. So, if you are a person that's like absolutely has to be on time for everything, please let me know so that I'm aware of that, so that I can be really mindful of that, because I'm going to give you the time that you deserve. And it may not, I do pretty well with my time. It's not super, super long, but sometimes I run behind. It's not a perfect science, but I just want you to know we do 30-minute appointments. It makes the time go by well when you come prepared. You do your assignments, you write your questions down. I have a great patient. I love her to pieces. She always types things up for me, and it just makes it so easy because I go through, I answer all her questions for her. I write them down. I, go through all the stuff on my end. Like it just keeps it really clear and clean and easy. When you're working with me, I do two options for holistic care. So the first option I'll go over is pay per visit. So I charge, and I have not gone up on my rates in years, I charge $325 per visit. So you're getting 19 years of experience, you're getting all those degrees, all that education, all those different, my tool bag is huge at this point. And so I charge $325 per visit. There's no long-term agreements, commitments, etc. I give you a supplement plan, I give you a meal plan, and you're off to see the wizard. Like you go do what you want to do. I found that most people with chronic issues need long-term care. They're not at the place where they can self-manage. They need some accountability. They need support. They need direction. They need guidance. They need to ask questions. And so that's why I became a concierge doctor, is to provide that long-term care so they can access me through messaging. I can give them personal guidance, and I can really walk them through step by step. And because of that, I give them a really good discount, because 325 times 12 or times 4 or times whatever, can really be very cost prohibitive for a lot of people. When I'm working with people for long-term care, it is the person's responsibility, it is the practice member's responsibility to manage the plan appointments. We do try to call you if we haven't seen you in a while. We try to get systems in place with that. It's just a lot on us to try to manage. And so we do want you as the practice member to be more proactive instead of reactionary. In our annual care meeting, we see each other once a year. You have sick care visits with it. You have detox appointments with that. You have blood work reviews with that. It's $420 for a year. So you get several appointments for that flat fee. For quarterly care, I see 4 general visits per year, plus your 2 blood work reviews, 3 sick care visits, and your 6 detox appointments. That's $780 a year. Preventative care is monthly, meaning I see you once a month. There's a fee schedule for that. Chronic care, I see you 12 visits as well, in addition to your sick care visits and detox appointments, and it's all inclusive. Like all your services with us are all included in your care plans. And then acute care plans are bi-monthly, so I see you once every 2 weeks. So we kind of put you where you are based off your lab work. And I've been doing it for so long at this point now, I can say, oh, you're a hypothyroid case, you're going to be preventative care. Or, you've got multiple specialists in your oncology case, you're going to be acute care. Oh, you know what? You've been with me for a while, you've stepped down already, you're an annual care. And that's the goal, is that we start you off at a higher plan. I teach you from the ground up really how to heal yourself. And then as you get better at managing your health and you learn more, then you step down to, a lesser plan. So you get incentivized for being responsible for taking care of your health and getting well and really just staying well. So there's a lot of benefit to that. So appointment management tips. So this is more so you can get really the most value out of your plan. If you are a plan member, you want to pre-book your appointments, meaning you want to schedule them up front. You want to book your appointments before you leave. So we try to kind of hand you off to the front desk. We say, okay, I'll see you back in 3 weeks, or I'll see you back in 4 weeks, or however long. And you want to bring your schedule with you. Write your assignments down as well. So if you have an assignment that I give to you, write it down. We do put it in your chart as well, so it's there. You want to bring a notebook too, and journal or write it in your app. So we do have a lifestyle app for everybody, and so there is a journal section in there, so you can journal, jot down some notes from your appointments in those as well, because you always have your cell phone with you. So we just ask that we try to maintain your appointment structure and integrity. So also too, you can get the most out of your appointments. That's really what it's about. I'm going to go over all the appointment types. We have 2 consult options. I do sick visits for people that are not practice members. I do physicals for people that are not practice members. Of course, I do sick care visits and physicals for practice members. General visits will review of findings, classes, as well as our detox appointments. Consultations. So I have 2 options for consults. 15 minutes, really brief. It's complimentary. I just kind of get a feel of the case. You get a feel of me and how you think I may benefit your healthcare team. So it's a real brief. I give usually 1 complimentary appointment once every 6 months. So it's not like you can keep coming back for the complimentary appointments. Once every 6 months works. And then I also have a more extended consult, which is a 60-minute, up to 60 minutes. So, I'm not here to kind of drag stuff out of you. If we have the time scheduled and I ask it, hey, do you have questions, that kind of thing? You're like, nope, everything's good. And in only 30 minutes has passed. We're not just going to sit there and stare at each other for 60 minutes. We'll move the appointment along. And then also too, we'll probably make up that time on your review. So we do have a second review of findings appointment. That's usually 45 minutes. So really your first 2 appointments are included. Your initial 60-minute and then your review findings appointment are included in your consult fee. Might I add, the 60-minute consult is $200. The 15-minute is complimentary. Okay, so sick visits. So again, this is for acute care. People that are not practice members of my practice can come in on sick care. So that's if you have cough, cold, flu. We do same-day treatments. There are emergency visits. So, oh my gosh, I woke up, I have a scratch in my throat. What do I do? We can get you same-day appointment as well as treatment. So it's like a lot of times I'm waiting for labs and that kind of thing. But in a sick care visit, I usually use AK, and then I figure out what's going on. Is it bacterial, viral, parasitic, heavy metal, whatever, and I give you a remedy that day. It's, like I said, available for non-practice members as well. Physicals for school and work, they're very comprehensive, a little different than your standard physical because we do metabolic assessments. I'll do applied kinesiology if I need to. I'll do a nutritional assessment, and then just the naturopathic physical that we offer. So we're looking for a lot of different things. We're looking for, again, the state of health in the body, not the state of disease. And then we sign off on physicals, etc. Review of findings, those appointments are to review lab results. So in a standard preventative care plan, I review your lab work in 6 months and then at year end. And then the year end, we determine if it's step down or you're done with the practice. And so we review your lab work. I usually give you a 30-page report with every review. If it's a basic blood lab, if it's a functional lab, they're usually a lot smaller, like 4 or 5 pages. So I can review your basic as well as your advanced laboratory. I'm also trained in genetics and methyl genetics, so I can run full raw genetic reports. I access your labs at every visit. So even if you're in a general visit, I'm always going to look at your labs and see where we're at, because I'm targeting specific areas in your lab work. I tend to run labs every 3 to 6 months. If you're a chronic care practice member, I'm going to see your labs every 3 months, because typically those are people that are at cardiovascular risk. So I need to make sure that I watch their labs more closely. And then 6 months for most standard patients, other than like severe autoimmune cases and cancer, things like that. I typically run a comprehensive panel. So I'm going to run a CBC with differential complete blood count, expanded immune system, CMP14, which is a comprehensive metabolic panel. That's your kidney liver function, lipid panel, which shows me a little bit more about your liver function, lipid oxidation, inflammation in the body, as well as just a standard TSH. Labs are typically covered under a PPO insurance. And if you don't have insurance, we do have a reduced out-of-pocket cost. And so that reduced out-of-pocket cost, we try to keep it as low as possible to help people. So I think like that standard panel is like $97. General visits are typically, if you're doing a one-off general visit, like a paper visit, or if you're in a plan, like I was saying before, they build upon the next. So each appointment we're focusing maybe one on nutrition, maybe one on modifying nutrition, maybe one on digestion, maybe one on the liver, et cetera, et cetera. I'm always going to review your current labs. I'll order new ones if applicable. I'm going to review your supplement plan. So it's good to know what you're taking, why you're taking it. I'm going to review any assignments, written assignments or worksheets that you've done. I'm going to review your food diary. We have a Body Sight app that we use to track your food. And so we're going to review that data. We also review your mindset and your emotional state, because that is like 80 to 90% of it. If your mindset and your emotional state are not in the game, it's very, very difficult to keep up with lifestyle habits, to keep up with your food, to keep up with your supplemental plan, etc. So I'm always doing check-ins on the mind and the emotional state, and that's why I have a lot of those techniques to really help the mind and the emotions to reset behavior. We want to educate you as much as possible and answer all of your questions. Sometimes I may have to say, yeah, we can answer that, but why don't we wait till here? Because remember, sometimes we're coming into the practice from more of that old paradigm of react, react, react. And so we want to fix it now. We want to fix it now. So part of my job is to slow you down and regulate you and help you to stay on task, because otherwise it'll be like a dog chasing its tail. And the same kind of behaviors that got you in the place you are with your health is not going to get you out. And so I think that's a big challenge for people initially, because people come in and they want to do the same thing that got them there, but it doesn't work. And so sometimes there's little control struggles, sometimes there's a little judgment because the ego doesn't like it. So they'll start to pick little things like, oh, the scheduling is off and the paint color is bad, and you're this, so we're making dramatic changes in the psyche and the emotional, anywhere that you are stuck. I think a lot of people don't realize that when you're coming into a holistic practice that's very God-led, my practice is extremely God-led, and so all the stuff that's holding you back in life is going to come up to the surface, and it's going to smack you in the face, and you're going to want to react, and you're going to feel all kinds of feelings that maybe you haven't felt in a while because you shoved them down. And so all that stuff is coming up to the surface, and it's got to come up and out. And so it can be very confusing. We do create a safe space, but it can be very confusing because the tendency is to become more
aggressive, if you will, with that kind of stuff as it comes up, because a lot of people aren't used to becoming more conscious and becoming more aware. And so we do a lot of sitting with these, uncomfortable emotions, and I teach you what to do with them and how to heal them and how to work through them, and all the disappointments and frustrations and pretty much anything that is holding you back and keeping you stuck. How you do your life is how you do my practice. And so it's all going to show up. On a lighter subject, our detox appointments. When you're a plan member, you do get detox appointments in your plan. So you get your basic detox services. Preventative, for instance, gets 12. Some of the other ones get 6, some of the other ones get a little more. So our basic detox is meaning using the body's own ability to detox, not adding anything to the body, is our biomat, our dry sauna, our foot detox, and our steam. The biomat has all kinds of minerals in it, infrared as well. You lay on it for 45 minutes to an hour. Our dry sauna is infrared too, little bit different. I like to burn things off and induce fevers with the dry sauna and the biomat, but specifically the dry sauna, really good for chelating things out. The foot detox is also really helpful too, really good for inflammation. A lot of positive, negative ions, and it's taken more from Eastern theory than Western theory. So I don't think a lot of people understand that it's not a biochemical reaction as much as it's bioenergetic. And then steam. So we do have a steam canopy, and we steam people with that. Advanced detoxes we add things to the body, so like minerals, salts, or essential oils, things like that. And then expert detox programs, which we'll talk about later, are like our 21-day detox, our 30 days to healthy eating, our 21 days smoke-free, weight loss in a box, etc. We have several different expert programs like that. So your typical treatment plan is going to look something like this. We do your consultation first, either your 15 or your 1 hour. Then we'll do your follow-up review of findings. At that time, we'll talk about if it makes sense for you to do a pay-per-visit or if it makes sense for you to do long-term care, whichever one we decide. Let's say if we decide long-term care, because naturally if you do pay-per-visit, you're going to jump right to general visit. There's no need to do a physical. So if you do long-term care, you'll do a physical next. That's usually done within the first month. And then you'll do a general visit. That first general visit is where I typically make my first remedy recommendations, because I want to get your physical out of the way. Sometimes that can take a little bit of time. I want to see the current supplements that you're on. I want to get any medical records back from other providers. I want to get your medication list to make sure there's no interactions that I need to be aware of. So those are, and I also want to look at your food, because supplement is just there to support the food. It's not there to replace the food. So I need those few things. So that's, again, a paradigm shift, because a lot of people want the reactive part of it. Like, okay, so now how do I fix it? Give me the pills. There's no magic pill. It's built over time. So that can kind of take a little bit of, there's also a comprehensive, medical history that you'll have to fill out online, and that is a 3-part process that takes a while too. So I need to get all that data back. Remember, I'm a clue finder. I need as many clues as I possibly can get from you in the shortest amount of time to be able to pinpoint down, what's going on. Your second general visit is usually a follow-up on your remedies. We'll talk more about your food, kind of what's coming up, etc. And then the next month, really at that point, you're really in the thick of it. All the mindset stuff comes up, the emotional stuff comes up, all that stuff comes up. And of course, that's where all the NLP and the clinical hypnotherapy and all those other techniques, modalities that I use in the subconscious mind. I teach you the difference between your conscious mind, your subconscious mind. So I go over all that information. Your fourth general visit, typically we're prepping the body. I start with the liver first. So we're prepping the body for detoxification. So that's where your detox services come in. And so you'll do your basic detoxes. You'll start that. Then once that kind of mental, emotional, spiritual stuff is coming out, physical expression of detoxification, we do your first actual organ detox. And then we let the body rest a little bit and we rebuild on the body. We start to shift and work on another organ, and then just in time for labs and reviews. So notice it's like month 8. So I can move as quickly or as slowly as you need me to move. This is just kind of like a standard how it works out within the practice. In between appointments, I give you tools to self-regulate yourself. In the process, we want to define what an emergency is. So things like cough, cold, flu symptoms, the same day. The sooner we jump on that, the better. And we want to reach out when you have pain, you have a change of symptoms, you need help. And you do that through our online patient portal through Dr. Chronos. So you just log on, you put the information in there, and then I'll get those messages. Really good for general messages, uploading documents, labs, medication changes, etc. A lot of times though, if you can condense the messages, that's really helpful. And then understand too that I may not answer every single question. I may say, you know what, I think we need to talk about this in your appointment, because or sometimes I'll even call you because there's a lot to go over. Like I'm so hoping that you guys can see now that my job is very complicated. Like it's not, I know the existing paradigm in healthcare is like quick, and you come in, you got a symptom, here's a pill, and that fixes it. This type of practice, healthcare practice, is very detailed. I'll do another webinar about levels and layers of healing. Like there's a lot to it. I'm looking at you from all different angles and perspectives. And so I can't always boilerplate that down as much as I would want to. You also have your Body Site app. Send questions about your programs. I'll shoot your meal plans through there. So you track your water, you track your food, you track all your metabolic levels and stuff in that particular app. Things to keep in mind for yourself. So you are responsible, okay? This is your healthcare. I am here for you. I am accountable to you. I am also accountable to God to be of service to you. But ultimately, you are responsible. If I give you clear message that I'm receiving and I say, hey, X, Y, Z, A, B, and C, and you don't do it, I'm only as good as you are compliant. So you can move as fast or as slow as you so choose. I remember I had a case years ago. I just loved her. She was so great. And she's a sweet country woman. She came in, she'd done a lot of reading and researching, but she was so open. And I think that's a really important part. So she was open and we worked together. And like in 6 months, she came in one day with her husband. Her husband would come with her too. It was so cute. And, older lady. And so she goes, I think I'm done. And I go, well, let's see, let's pull out your goals. So we pulled out the goals and we looked through them, and sure enough, bam, 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 like she accomplished everything. Like all the goals that she set out to intend to accomplish, she got them done in 6 months because she got out of her own way. She took the direction and she did what she needed to do. And so really, like, you can get this program done as quickly as you want. It's just getting off of it faster, so the faster you get off of it and get out of your own way, the better off we will all be in the process. With that being said, take the coaching, be open to the shifts. I know change is super hard and there's all kinds of things going on. And it's not going to feel comfortable, and stuff's going to come up, and you're going to feel all kinds of emotions, sad, mad, glad, all kinds of stuff. But just be patient with yourself, be patient with the process. It is so worth it when you have those breakthroughs, I promise. Withholding communication is not healthy. When you withhold things, okay, what happens is that's a frequency, right? You don't realize it, but it's a frequency. And so you're storing that frequency of resentment, frustration, lack of communication, anger. You're storing that usually in the liver, people store it, or in the digestive tract. So you're storing all that. So withholding is not healthy, and you're not going to spare my feelings in any way. I am like built like steel, honestly. And so I've heard it, I've seen it, I've dealt it out with some of my healers and teachers I've worked with over the years. So I'm just here to really hold that container and hold that space for you. So communication is key. you want to be able to express and communicate, because honestly, what's stopping you is actually what's stopping you in life. So it's not just about this program. It's like whatever's coming up for you, whatever's holding you back in your health, in your finances, in your relationships, whatever the case may be, it's pervasive. It's throughout. It's like a disease throughout your entire life. And so we want to get that stuff out. And as difficult as it is, the payoff that you get from being stuck, shut down and unhealthy, on the other side of that is a significant breakthrough that I'm trying to elicit and create for you. The things that I will teach you, you already know. So I'm not going to teach you anything that your higher self isn't already dialed into. You already know who you are, what you're about, and you can feel it. You can resonate with it. Sometimes the truth will first piss you off and then it will set you free. However, at the end of the day, the things that I'm sharing with you, you're going to take with you and it's going to resonate somewhere. I built this practice from a vision, right, in my mind. So I think sometimes people come in with an expectation. That expectation may be realistic or unrealistic. As much as I'd love to be a Fortune 500 company right now, I'm not. I still am my practice is still growing and it's still building. There's a lot of kinks I'm still working out. I'm still fleshing out systems in place. We're putting a lot of things in place. I'm always shifting and changing and growing and healing myself. So in different visions shift and change. So flexibility is really important in our practice, and remembering that nothing is happening to you, it's happening for you. And I think if you can keep that positive mindset when things, don't quite work out the way you want them to work out just in your life, you'll definitely have less suffering, which is what we all want, right? So I want to be clear on what my job is for you. My job is to hold space for you. So I'm that container, I'm that vessel. You just pour right through me. So I'm not holding on to anything. Like, you're not burdening me. I've been doing this a long time. I don't take all this stuff with me. I am a vessel. It pours through me. My job is to guide you, direct you, teach you. Doctor in Latin means teacher. My job is also to push you. So I'm going to get you past your comfort zone and where that doesn't always feel so comfortable. But then on the other side as well, I'm here to support you and really love you. And I know that sounds awkward because, like, love me, you don't even know me. People have all kinds of ideas about love. Love for humanity and love for humankind and love for healing is literally, it just exudes out of my every cell of my body. I absolutely love people. That's why I do what I do, to be able to help guide people and help facilitate these breakthroughs. It's like literally watching a miracle happen every single day. And I'm truly blessed with that. So really understand that can be a little uncomfortable too. You may have to deal with a little bit of that. I am here for you. I'm really good at communicating my boundaries. I'm good at saying what I need, so it's not necessary. I'm here to hold that space for you. So if I ask you to text me, there's a reason for it. If I ask you to email me, there's a reason for it. If I also ask you, please stop, there's a reason for it, like I'm gonna guide you and direct you and teach you wherever you need to go. Just a little bit more about who I am. So you just get an understanding of like who I am and what I do. So I'm very God-led. I'm very God-centered. I'm highly trained in my field and what I do. I'm also highly coached too. So just as I'm a coach to you, I have 2 life coaches. I have a business executive coach. I have a therapist. I have other various coaches. I'm trying to think of anybody off the top of my head now, but I am literally wall to wall. I'm being coached all the time. Like, I welcome that in my life. So, the role that I'm serving for you is your coach, your teacher, your mentor, etc. And I think sometimes, especially if you're a healer and you're coming to me in the capacity of being helped, and you're not necessarily used to being in that vulnerable position. You're used to being more of the person always giving and not receiving. I say that to you to be aware, like, I don't need coaching from you. I have a lot of coaches. I have a lot of people that teach me, guide me from all different angles, both spiritually, mentally, emotionally, business wise, etc. So I'm really good. I appreciate your feedback to a point, but at the same time, I have a lot of practical experience in what I do. I'm always moving energy. I'm always transforming. You're always going to see the practice going through transformation, because again, this is a vision from my head. Literally, there's no other practice like this anywhere in the country that works the way that we work it. And so I'm always going to be moving those energy. I'm always going to be learning. I'm highly focused. I'm a great communicator. I use my words very, very carefully. That's why I'm trained in neurolinguistics, because words, frequencies are definitely really important to me because they create your world. I'm going to definitely point those out to you as well, because you're creating your world with your communication. So I'm not picking on you when I point that out. It's more or less me making you aware, helping you to become, not making you, but helping you become more aware of what it is you're trying to create for yourself. And so I'm hyper aware to that. I'm very personal, open, and loving. I love people. So you feel, I say all these things because you're going to, when you work with me, you feel almost like you're my best friend, right? Even though we're not best friends, I have that kind of motherly, Mother Earth energy going on. It can be a little confusing for people because we're so used to, we're programmed like, a professional is supposed to be cold and they're supposed to be withdrawn and they're supposed to be like, you're over here and I'm over here. And we have all these ideas of boundaries, etc. And I have healthy boundaries and I can communicate them. But that doesn't mean the work that I do, it requires me to be open. And I'm a very open-hearted, vulnerable person. And so you're picking up on all that love and all that just welcoming. And I create myself as that to be able to help you through a process of healing. With that, I'm a pioneer and a leader in my field nationwide. I work with doctors all over the country to work to advance naturopathy, because my practice of naturopathy, if we don't repopulate our profession, we are like an endangered species right now. We are going to be extinct. And so really, looking to expand this practice. So just keep that in mind as a pioneer. All right, who you be. So in life, you are a human being, right? So who you be to show up in my practice and to get the most out of it, here's who I ask you to be. I ask you to be open-minded, be curious, not resistant, curious, right? Because I've learned a long time ago, anything can be anything. So be open, be curious, trust the process. You don't have to trust in me, trust in the process, because really he's guiding all of it. Be human. That means, if how are you doing today? I'm not doing good. I don't feel that. Be human, be emotional, be raw, be uncomfortable. Like I am so comfortable with emotion. I feel it, I experience it. Sometimes I'll be at an appointment and something will move me. I'll cry because it'll be beautiful. So like I had this one case, oh my gosh, it was amazing. Like finally a family member had gotten the healing that they needed. And it was like, oh, just out of nowhere, like just showers of tears. And so I'm very comfortable in that space. So be uncomfortable, let go of control, be humble, be open, be teachable. It's taken me years. I make my profession or my career or whatever, my job, if you will, I make it look very easy, but it's taken me a long time to cultivate and understand, a lot of schooling, a lot of education. So be humble, but be open and recognize that this is a process. Like where I am today was not where I was 19 years ago when I showed up at that massage school. I mean, I was a mess then. And through my own healing process and through my own healing journey of my own, I've been able to not only learn the book stuff, but also the practical application, which makes my practice very unique, because I'm not just teaching you from, okay, this is what I learned in this book and that book and this book. I'm going to say, I broke all that down. Okay, this is what I learned in the book. Once I shredded it to pieces, this is the practical nugget. This is the clinical pearl that I got from it. This is what's going to help you along the way, and watch this and be mindful of that. That's being that tour guide for you and really helping you, hey, this is going to be a little uncomfortable, but do this and do that. So I give you a lot more practical guidance when you're a practice member, because I'm walking a journey of a whole year with you. So just in case you didn't know it and nobody told you, you can do this if you want to do it. So really be open-hearted. Like, there's something that draws you to me. There's something that draws you to the practice. I remember years ago, I had a lady, I love the lady. She's so sweet. And she was like, I was driving down Alaskan Road and something told me to pull in here and come in and check it out, right? Like, people are drawn to that energy. They can feel it, And so you can do it. Like, I am you and you are me. I had a healer that I worked with years ago, and she would say that to me. And that was very comforting. It's like, you can do this. Like no matter what you have going on, what junk you think that is holding you back, or how many awful things you think you've done, like, you can do this. And I believe in you wholeheartedly. That's where that love and that unconditional love and support comes in. So you can do this if you want to. If you want it bad enough, like I wanted my own healing bad enough. Like, I came from a really difficult childhood upbringing. My parents were a mess, and I wanted health and healing so bad. I wanted a family so bad that I actively pursued my own healing in order to attain that. And I'm still striving for it, and I'm still working on it. It's sadly, unfortunately, as humans, it doesn't stop until we take our last breath, And so we can either grow from it or learn from it. We can allow it to define us or refine us. And so it's really just taking it day by day, moment by moment, slowing it down, recognizing this too shall pass, and you've got it. So want to make sure that you really embody this and understand that there's going to be a lot to do. However, guiding you step by step in the process and encouraging you along the way is going to do wonders. So a few new programs that I'm releasing in May. So if you're watching it current, we're in May of 2020, COVID-19. And so a couple programs that we're going to be releasing. We have our 21-day smoke-free, but I'm doing it in a different format. We have our 21-day organ detox, and I'm doing it in a little bit of a different format. We just finished off our 30 days to healthy eating, again, a totally different format. And then I have a program coming out called COVID-19 2021, but who's counting? And that is we've all been sitting at home. We've been on lockdown. We've been eating and ordering from all these yummy restaurants locally. And we haven't, the gyms have been closed. So we haven't been able to, work out, all that kind of stuff. And yay, we have worked out, but it's not the same, so yay. We're right here at bathing suit season. Yay, go us. So look out for COVID-19 2025, who's counting. That is specifically for your metabolic health and all the comorbidities that were involved with that particular virus. And then we have our 90-day Beachbody Ready, and that is a really fun program that we're doing along with our body contouring device. So those are some cool, healthy programs that are going to be released this month. And if you're watching it in May 2021, because I'm always shifting and changing, there's probably another program as well. So anyway, thank you so much for attending our practice again. If you want to schedule any of these appointments, please feel free to reach out to us. Our office is on Laskin Road. Our website is holisticfamilypracticeva.com. That's holistic, spelled HOLISTIC, family practice VA as in Virginia.com. Call our office. You can stop by, you can text our office, and email our front desk. Our front desk email is frontdesk@holisticfamilypracticeva.com. I hope this was super informative for you, and I hope you were able to learn something a little bit more about holistic practice and what we do and how we help families live naturally. So have a good one.